Artificial intelligence doctor. User question. What are the key physiological indicators that can predict the onset of the terminal phase in elderly individuals? GPT-01 answer. Identifying the onset of the terminal phase in elderly individuals involves recognizing a combination of physiological indicators that signal a significant decline in health. These indicators often reflect the body's gradual shutdown and can help healthcare professionals, caregivers, and families prepare for end-of-life care. Here are the key physiological signs to watch for. Significant weight loss and cachexia. Description: noticeable loss of body weight, muscle mass, and overall strength. Implication: indicates the body's inability to maintain nutritional balance, often due to decreased appetite or metabolic changes. Decreased oral intake. Description: reduced desire or ability to eat and drink, difficulty swallowing, dysphagia. Implication: leads to dehydration and nutritional deficiencies, contributing to further decline. Functional decline. Description: increased dependence in activities of daily living ADLs, such as bathing, dressing, and mobility. Implication: reflects loss of muscle strength and energy, indicating progressing frailty. Changes in vital signs. Description: altered heart rate, either tachycardia or bradycardia, low blood pressure, hypotension, and irregular breathing patterns like Cheyne-Stokes respirations. Implication: suggests cardiovascular instability and decreased autonomic regulation. Neurological changes. Description: increased periods of sleep, decreased responsiveness, confusion, agitation, or delirium. Implication: indicates diminished cerebral function and possible metabolic imbalances affecting the brain. Skin changes. Description: mottling, bluish or purplish discoloration, cold extremities, pallor, and cyanosis, bluish coloration due to lack of oxygen. Implication: signals poor blood circulation and reduced oxygenation of tissues. Decreased urine output. Description: oliguria, reduced urine production, or anuria, absence of urine. Implication: reflects declining kidney function and decreased fluid intake. Laboratory abnormalities. Description: elevated levels of urea and creatinine, electrolyte imbalances, such as high potassium levels, and changes in blood pH. Implication: indicates renal impairment and metabolic disturbances. Respiratory changes. Description: shortness of breath, dyspnea, periods of apnea, temporary cessation of breathing, and agonal respirations, gasping breaths. Implication: reflects respiratory muscle fatigue and central nervous system changes affecting breathing control. Terminal secretions. Death rattle. Description: noisy breathing due to accumulation of saliva and secretions in the throat that the individual can no longer clear. Implication: indicates loss of reflexes that manage airway secretions. Altered consciousness and cognitive decline. Description: reduced alertness, unresponsiveness, or slipping into a coma. Implication: signifies significant central nervous system decline. Gastrointestinal changes. Description: nausea, vomiting, constipation, or incontinence. Implication: reflects decreased gastrointestinal motility and function. Systemic inflammation and immune decline. Description: increased susceptibility to infections, fevers, and elevated inflammatory markers, like C-reactive protein. Implication: indicates weakened immune response and systemic stress. Generalized edema. Description: swelling in various parts of the body due to fluid accumulation. Implication: may result from heart failure, low protein levels, or kidney dysfunction. Emotional and psychological changes. Description: withdrawal from social interactions, decreased interest in surroundings. Implication: can be a natural part of the dying process as energy wanes. Assessment tools. Palliative Performance Scale, PPS, measures functional status in palliative care patients. A declining PPS score indicates worsening condition. Karnofsky Performance Status, KPS, assesses a patient's ability to perform everyday tasks. Lower scores suggest greater dependency and decline. Considerations. Holistic evaluation. It's essential to consider these indicators collectively rather than in isolation. The presence of multiple signs increases the likelihood that the individual is entering the terminal phase. Individual variability. The progression can vary widely among individuals due to differences in health conditions, diseases, and personal factors. Professional guidance. Healthcare professionals should be consulted for accurate assessment and to guide end-of-life care planning. Conclusion. Recognizing these physiological indicators allows for timely initiation of palliative care measures, ensuring comfort and dignity for the elderly individual in their final days. Open communication with healthcare providers can help manage symptoms effectively and support both the patient and their loved ones during this challenging time.